Good afternoon, ladies and gentlemen. This is July 27th, special meeting of the Board of Supervisors. Could I get the clerk of the board to do a roll call, please?
Supervisor Angus?
Here.
Supervisor Johnson?
Present.
Supervisor Gould?
Here.
Supervisor Watson?
Present, thank you.
We have a quorum.
Okay, thank you very much. The one and only item we have on the agenda today is a discussion with our Public Health Director with the Board of Supervisors regarding the recent issues, actions, events, and county responses in regards to COVID-19. And we'll be taking any actions necessary based upon these updates. So Denise Burley, the floor is yours.
Wonderful. Madam Chair, members of the board, thank you. I'll start off, as I usually do, with the numbers. There's been a total of 2,715 cases in the county to date. I know our website has not been updated yet. The morning report just came out, but we have 962 recovered of those 2,715 cases. 127 deaths, and we still have seen an increase in community spread and number of cases throughout the communities, with a modest change in our average age of cases, and that is 48.5, and the average age of deaths remains at about 77.4, so that's changed ever so slightly. So some other stats that I'd like to share with you. We have and can be happy to say that we've seen a decrease from previous weeks for the first time in months. Not cause yet for celebration, but it is progress for sure. We still had 377 cases reported out last week, which is still among the highest 4 weeks since the pandemic started. We continue to see a steady 8 to 10 deaths a week, and we're hopeful that at some point we'll see a decrease, of course, there. Anecdotally, it sounds like more businesses are requiring masks for customers to enter into their businesses, and I think overall you are starting to see some of the effects of that as we start to see a decrease. And hopefully that does become a trend, and hopefully we do see that number continue to go down. We continue to see more spread identified through households. And that is something that Supervisor Gould has brought up in the past, that family members are sharing the virus within their families, and some friends, of course. So the recommendation, of course, within that is if people are experiencing symptoms, certainly to wear a mask and to social distance, even within the household, and we recognize the challenge of that, but also trying to keep everybody in a household well, and trying to take those necessary steps to do so. Sorry, I was going to save that for a different section here. I did want to highlight some new information from the Centers for Disease Control and Prevention. There are new release from isolation guidelines that they've presented, which hopefully will help people in terms of getting back to work more quickly. So they base it on a symptom-based criteria, and instead, what they've done is changed from at least 72 hours to at least 24 hours have passed since last fever without the use of fever-reducing medication. So that's 2 days. That shortens that isolation period down 2 days. And also changed from improvement in respiratory symptoms to improvement in symptoms. And that's primarily to address the expanding list of symptoms that have been added to the CDC website. So knowing that it's not all respiratory driven. I'll give you an update on are there any questions so far?
Any questions?
To make sure I slow down and stop and breathe.
None yet, Denise.
Okay.
Thank you.
All right. Offer you an update on the testing. The North Country Healthcare testing event in Bullhead City Friday and Saturday was successful. It went very well and very smooth. Each day, they had individuals, so prior to the event, people had to pre-register. So these were all basically appointment driven. And they needed to register, and then they were given a time to show up, and they did a mobile drive-through testing event. On each of those days, they tested 100 people, between 8 o'clock and approximately 10 o'clock in the morning. The event was actually scheduled to go through 11, but it went so smoothly they were able to get everybody through that had registered through 10 o'clock. So I think moving forward, their goal really is to implement some of the strategies that they learned through this testing event at their individual sites and clinics, and that may offer opportunity to increase their testing that's available in their offices and through a drive-through process outside of their clinics. So I see that as definitely an opportunity there. And then, as mentioned on Friday through the press release, and it was added to our website, CVS in Lake Havasu City and Kingman are now offering testing. We did, I believe, provide the hours that they're providing that, the process needed to go and register for that. And they also have a screening tool. So primarily between North Country and all the other providers, or many of the other providers, they're doing symptomatic testing. Now, going back, I apologize, I skipped a very important piece of information for the North Country Healthcare site, is that at those testing events Friday and Saturday, those were for any individuals. They didn't require symptoms. So we should have additional data from this particular event because they did ask on their screening tool whether or not people had symptoms. So I hope to have that information available to you Thursday to present more detailed information about the testing. They also use a different lab, and so the lab results may be back before the Thursday meeting, and if that's the case, we'll know number of positives, and I can share that information with you as well.
Okay.
Staffing update. We had as I mentioned before, the 6 community health education specialists trained as of Wednesday afternoon last week. Between Wednesday afternoon and Friday, close of business at 5 o'clock, those 6 individuals had completed 93 investigations. So we have 2 additional investigators coming in. Actually, they start today, so they should be trained up by Wednesday. We have an additional interview today for one more investigator, and then we actually have an interview for a nurse tomorrow, so I'm hopeful. Additionally, Human Resources helped with the hiring process for the 2 office specialist positions. Those individuals will start respectively next Monday and the Monday following. So we'll have some additional staff there as well, which is great because we've learned that our National Guards person that was doing quite a bit of work for us is also leaving us. And so we'll be able to fill that position with one of these individuals, I believe, at this point.
Good timing.
Yes, right? But they've been well utilized, and we've gotten them trained very quickly, which was the goal that we had been planning for and preparing for and moving forward with. So finally, based on conversations about data that have gone on here at our board meetings, Public Health is working on a template that can be shared on the county site and linked to social media sites or any other sites that people want to use. And this data template will be such that it'll incorporate more data than we currently have available on our webpage, but data that we can share and are comfortable sharing. And all the data that will be included in this particular template will be all provided through our epidemiologists in public health. So that will be the source of the information, and we'll just provide it in a format, hopefully, that is more user-friendly for those individuals that like things either presented a little differently in different tables. We're working on the format of that and trying to put in some visuals in addition to just a data number, but also looking at some graphs that support trends and looking at the data in different ways. And I'm hopeful that I'll have that available to you on Thursday to present and get your feedback and thoughts and buy-in, and then we can move forward with finishing that draft and finalizing it.
Okay, and Denise, are you speaking to all 5 supervisors to get their input on this graph?
Yes, I am. I would like all 5 to provide that input and feedback so that we can make sure that it meets everyone's needs.
Thank you.
And we're really looking at the public needs in all of this and how that data is presented. That's our that's, another piece of this is making sure that the data that's out there is easy to read, easy to understand, and in a real logical form so that it flows well.
Thank you very much. If the public can't understand it, it's not of any use, so I appreciate you doing that. Thank you.
Certainly. Supervisor Watson, we're working on your question regarding mortality rates and whether or not certain populations are affected more adversely. And I don't have an answer for you yet, but just know that we are working on it to get more information for you.
Thank you.
Certainly. And what we are seeing, though, is that while we can look at specific populations that might be harder hit, it's also reflective of where testing has been heavier or higher. So knowing that testing was available in one area over another, that meant that we're trying not to skew the results of that and really look and drill down at maybe some social factors that influence people's morbidity and mortality rate associated with COVID. So try to have that for you maybe on Thursday as well.
Oh, I realize it's not going to be easy. There's a number of variables involved, so
There are.
not going to be easy to put together.
Exactly. And with that, I don't have any other additional information, but certainly want to be available for questions.
Okay, I'll open it up to questions, and Supervisor Watson, do you have anything?
No, I don't.
Okay, Supervisor Watson? Sorry, Supervisor Johnson.
Thank you, Madam Chair. Maybe Denise can go over what is the role of public health during this crisis when testing is so far backlogged, folks are waiting past their quarantine isolation times for results, and public health is so far backed up on contact tracing we're not even contacting folks anymore.
That's a very good question, Supervisor Johnson. Our role is to follow up with individuals after we receive lab confirmation of cases. So I realize that when we talk about following up and we've got delays within the labs, some have actually, we've learned, come back 20 days later and people have already finished their isolation timeframe or their quarantine timeframe. In those cases where we can, we also still want to continue to reach out to those particular individuals, even if they're beyond their quarantine period, because we want to follow up and ask if they are still exhibiting symptoms and feeling symptoms, if there's any questions or issues, and that way we can provide them with some follow-up guidance. But beyond that, we rely very heavily on, especially related to the testing backlog, on the state and the local agencies or local businesses such as SonoraQuest and LabCorp and some of the other labs that are out there to try to increase their capacity to ensure that there isn't a backlog of testing and results.
But wouldn't our goal be, instead of gathering information that's outdated, shouldn't our goal be to try to slow or stop the spread?
Yes, yes. And I think what we're planning on, Supervisor Johnson, is to utilize those community health education specialists when they're not doing investigations for preventive type work and to do some education. And we actually have some staff that are dedicated, for example, in liaisons to school districts and to the superintendent of schools, knowing that school will start here soon. So those particular individuals will focus their efforts there, but we'd also like to work some on the business side and other entities to ensure that people have a place to go and that we're a resource for them for prevention messaging and activities.
I guess with the extra bodies that we've given you, I'm curious if we're not able to follow up in a timely manner with the people who have already had the COVID. What can we use these people for that might help us protect the people who haven't got it yet?
Mm-hmm. And that's a great point. I think you're spot on there, Supervisor Johnson, in that we're going to use these people for more education. And if, we have some thoughts about how we might be able to reach out to these particular communities. We can use chambers of commerce and use that as a resource for getting information out to businesses. We've got the liaison for the school districts and working with the superintendent. So if there are other ways and other people that you would like to connect us to, we are open to that and certainly want to be available where we can be.
Maybe you can refresh me on what is it that our epidemiologists are doing?
So our epidemiologists receive all of the cases through MedSys. They review the information. They, along with the nurses, are doing case investigations. They're following up with long-term care facilities. Anytime we have cases in long-term care facilities, they're working closely with the nurses on those cases. They're ensuring all the documentation is there for each of these cases and entering that into, entering it into MedSys along with supporting documentation. They're assigning the cases out to the different staff to make sure that there's follow-up, and then they check back and make sure that those cases are being followed up on. But they don't necessarily have to do a lot of that. The nurses follow up, and then the temporary epidemiologist, Mayor Schumacher, is leading our efforts as far as teaching the investigative techniques along with our staff. And then until the coordinator comes on board next week, also ensuring that those staff have all the resources that they need to do the investigations, that they have a point person to ask questions and follow up. And then additionally, they're providing data for our reports, and the reports, both the weekly reports, the daily reports, any reports and data that you ask for, we usually reach out to our epidemiology staff to get that information. And then when we have media questions that request data, we usually reach out to them as well during that time.
Denise, I think our county manager has a comment. Mr. Elchers?
Thank you, Madam Chair. I just wanted to add to what Denise responded to with Supervisor Johnson. In an effort to stop the spread related to the investigators that we have, Supervisor Johnson, as you know, the board approved 12 positions in total. 6 of them started last week. 6 are starting today. 2 are starting today with 4 more to go. The intent is to bring those 4 on board as quickly as possible, and with 12 at hand, utilize 10 or 11 of those to be proactive and conduct and complete the investigations when the cases are ongoing, when we're made aware of them, and only have one person that goes back and trace, just for the record, some of the ones that have had it and have recovered from it. And the intent there is to learn if there is something to be learned, just to be able to document that we did do some tracing, though we know it's after the fact. But the intent is to focus our effort on current cases and new cases to achieve what it is intended with these investigations, which is to stop the spread. So I know Denise, excuse me, answered your question. I just wanted to add that to her answer. Thank you, Madam Chair.
Thank you.
Thank you. When we get to this chart that you're talking about, at least 8 counties post their current hospitalization numbers that come directly from the hospital report that we get sent daily. Pima County actually posts the report every day. Now, we were told that the state forbid us from making this information public. Is that just Mojave County they're not allowing to make this information public?
It is not, no. I mean, we've been given special, and not special, we have reached out to the state twice, to Arizona Department of Health Services, to ask for the release of that information. So let me follow up on what Yuma County is providing, and then I can look and see what we can do as well, okay?
All right. This is more of a statement, but I read an article over the weekend of the courts dropping a case that was 3 years old because they couldn't properly investigate and produce evidence in the case due to COVID. Now, I don't know, maybe you can contact the courts and advise them that we've only had COVID for 4 months, and a 3-year-old case shouldn't be being dismissed because of COVID confusion with the COVID case. That's all the questions I have right now, Madam Chair.
Okay, thank you, Supervisor Johnson. We'll go to Supervisor Gold.
I don't have a question, but I do have a statement. It'll be interesting to know in the Bullhead City blitz testing how many positives there are in people that have no symptoms. And hopefully that information will be available. Thank you.
Thank you, Supervisor Gould. I'll reach out to North Country Healthcare and present all the questions that we want answered and see what they can give us from that.
Thank you.
Okay, we'll go now to Supervisor Angus.
Thank you, Madam Chair. First of all, I want to thank Denise for listening and thinking about the best ways to get that information out and all the information. And I'm looking forward to seeing it on Thursday. And the intent was always for the best information in the best format to come directly from the county, and then each supervisor can link to it. So it's only coming from one place. So thank you. And as I said last week, I offer my office for help if you need help in the formatting and the dissemination of it. And I'm still hoping that we have to have a discussion about whether the public information office is what role they have in this as well. The only other thing I wanted to say was that last week I asked a question about people getting a recurrence of COVID after having it, and I believe you answered that there have been recorded instances. Well, in that new CDC website guidelines and information I believe you mentioned earlier, I was reading that too, and what I read said that there have been none in the 6 months. So I just wanted, again, to make sure that the correct information gets out, and if you saw that somewhere else, that's fine. Just wanted to say what the CDC is saying.
Absolutely.
Thank you.
Thank you, Supervisor Angus.
Okay. County Manager Elters, do you have any other comments?
Madam Chair, I have no further comments.
Okay, any other discussion from the board? Okay, this meeting's adjourned. Thank you very much.
Supervisor Johnson?